I will say something that probably nobody even thinks about, but I've been told this by other lost mothers with talking about their husbands or their partners. So when we had a midwife, and this goes for all midwives, by the way, this is not just CPMs. The midwife is very focused on like us, our body, our, you know, whatever, us and baby. So your partner goes to the appointments, but your partner is not part of the appointments. They don't even hardly react with that. Like there's nothing going on, no interactions, no nothing. It's very, very weird. And so, and you think about it, like birth, like a lot of times there's a lot of women, like, and I never thought about this until actually Madison, we were chatting about this one day, is that you think about birth, there's a lot of women that are like around. And if you don't have like a doctor or whatever, that's a man, you only have maybe the partner that might be a dude. And then that's it. And so you got all these women and all this stuff or whatever, but then the guy's not really included. And I never really I never thought about it, but Michael was not included in my care, in my prenatal care whatsoever at all with Gavin. He went when we hired her. She was supposed to move things around his schedule, his work schedule, so he could be part of it. She never did that. She always had an excuse of why she could never work it around for Michael to be at my appointment. Okay, that's my partner. That's who's part of this birthing. You're not even going to kind of work and schedule it out. We're doing month to month. It's not like I'm seeing you every single week for 9 months. Like we're doing, like we can schedule and figure it out. And she never could do that. She always was busy. She's a midwife. Like, you know what I mean? Like that's all she did. She didn't have another job, nothing like that. And when we had our rainbow, the doctor, when we would go in, he went to every appointment, by the way, every ultrasound, every appointment, everything. They worked around his schedule. We worked things out. They were really awesome about that, actually making him totally part of the birth. And we would actually go in. Not only would she be like, how are you doing? And checking me out and, you know, feeling belly and doing all these things. She would turn to him and say, how are you doing with all this? And she actually would have a conversation with him every appointment. And when we went to see the specialist, he did the same thing. How are you doing? And let's talk about this. And do you know how to change a diaper? You know, and like, you know, like stuff like that. And it was like, it was a different type of care because we were a team going in there and they seen us as a team and a partnership. But it sounds very strange. But when you think about it, the midwives are all focused on this body that's having the baby, but they're not focused on the partner and the family aspect of it. And I never thought about that until Madison brought it up, actually. So Madison, props to you for bringing that up, because I never really thought about it until she brought up about her boyfriend saying there's too much like feminine stuff going on, too much like, you know, there's too much women and not enough like with him in there. And I never really thought about it because I was like, what is this care? And then I started thinking about it and I was like, oh, wait, actually, he wasn't even allowed to go to the appointments when I had a midwife, when it was around our schedule, when we paid and did all this stuff. He wasn't even there. But then the hospital and doctor and all that stuff was all around us being together. I was like, oh, I can't do that ultrasound without him. Oh, yeah, what's his schedule? And they would like help me and work it out. It was completely different. And they treated us like a family instead of just me by myself. And that, I don't know if that's for everyone, but that's what I experienced. And then I started asking some other lost moms, and that's what they experienced too, was that they kind of put a little wall between us because they want to focus here, because at the end moments when he starts saying, is something wrong? Do we need to go in? Do we need to go to the hospital? Do we need to be induced? Do we need a C-section? When he starts panicking because, you know, he's seeing the other side, they start just totally blowing him over. Like, cause that's what happened within my experience, was that he started asking questions and they totally buffaloed him. Like, no, everything's fine. Everything's good. No, you don't need to call 911. No, we don't need to go to the hospital right now. No, just go home.
Oh my goodness.
And you know what I mean?
Yeah. You know, the emergency C-section was kind of just whirlwind. It really was. I And it happened after we had been at the hospital. He came in at like, I don't know, 10, 11. And I think he was born around 5 in the morning. So my husband didn't have enough sleep. He was not the sharpest cookie. But the second time it was planned C-section, he's part, they have someone assigned to basically handle the partner in the OR. And yeah, they tell them what's going on, what's going to happen, point things out to them. I mean, it's really cool because I, of course, could not see Jack, but someone in the OR was actually getting to have some fun. It wasn't me. So yeah, and yeah, I find it just really, really upsetting. I mean, the way they treat partners when things go wrong. You could have someone there who could be such if nothing else, who could provide support to the person who needs it most. They could help you in little ways if you wanted them to, but you just sit there and essentially put them on a shelf in possibly the least compassionate way possible. It's just, I find that very upsetting.
Like I said, I never thought about it until she was talking about how they were talking about having another baby and finding a male doctor. And she was like, yeah, he wants male doctor. And I was like, well, if that's what you both want, and then we started talking about that kind of side of stuff. And we started asking other friends of ours, and they all said the same thing, that if they had rainbows, they kind of did the experience was so different with their partner being involved with their babies versus at home or at a birth center. They weren't involved. They really weren't really involved. And which is really weird is we got told about the Bradley method. And, I'm sure you guys know what Bradley method is. Yeah. And so we were told, like, I think she might even gave us a book actually about the Bradley method. And it's basically like preparing your partner to catch your baby is kind of what it is. Like, it's preparing that your midwife isn't going to make it there and your partner is going to be catching your baby. And which we always say that's kind of like them telling you at the beginning that they're not going to be there at the end, but you just don't know that at the time. And so he actually got the book, whatever. And he's kind of like, I don't know if I need to read this book. Like, if it's just catching a baby, like that's easy, whatever. And we had my friend that was, I was like, we're just catching it. Cool, whatever. But one of my friends was in the community, and her and her partner, they were having their second baby at the same time that we were having Gavin. And he was like, we went to her baby shower, and he was just telling Michael, like, oh, it was just such an amazing experience to catch your kid, in water and all this stuff. And, and afterwards, I just remember him being like, God, it's going to be so dirty. Like, man, it's going to be so nasty. Like, birth this. I just remember, because we didn't want a home birth. We wanted to be at a birth center or somewhere else, because I was like, man, it's going to be like, we need a lot of towels. We need I was like, this is going to be, birth is messy. So I was like, oh, this is going to be a lot to clean up. And so that's what he thought. He's like, it's going to be a lot. But at the same time, there's this level of like hyping you up, like, yeah, you're going to give birth naturally and they're going to catch the baby. And so like the guys kind of almost have like this like guide code of like, yeah, I get to like catch the baby. And this is like a really awesome thing for, a dad to do kind of thing. But the experience ended up in a whole nother way where it was like later on, he was like, catching your baby is really not that important, being that you don't get to spend the rest of their life with them. You know what I mean? He's like, I would have anyone catch my baby and 100 people grab my baby, and then I can take him home and we can have the rest of the people. You know what I mean? He was like, do whatever you got to do. I just want my kid. And so as much as it was like, it was super cool to catch your baby, later on, it was kind of like, it's not that cool. Like, you know what I mean? It's not that great when you look at the risk of all the different stuff. And, and I'm unfortunately, but that's true. That's kind of what it is. But yeah, I was thinking about that. He brought that up. Yeah.
I've always thought of Bradley as a kind of indoctrination program for partners. I mean, it's like, oh, well, yeah, you have to be supportive. You have all this stuff you have to do, and it's really important that you do it. And it's like, guess what? I didn't have any of that stuff to do. My husband was like, yeah, just pass me the barf bucket and go back and sit down because like nothing you can do for me now is going to help.
But you know what? I do remember them asking him, they were asking him things like, how do you do with blood? And like, they were like asking him like these questions, and he was like, yeah, it's not a big deal. Like, and he's like, yeah, I've been wounded a bunch of times. And like, it's cool. Like he didn't think nothing of it. Like, yeah, right. And, it is a different experience like later on when we had the C-section and all this stuff. When the second time around came and we were planning our C-section, we were doing a gentle C-section. And we were sitting down with our doctor going over our stuff. We'd already looked it up and we were going to talk over what can we do and what can't we do. And the doctor was like, well, I don't have a clear drape. And he was like, I don't want a clear drape. I don't want one. Please don't do that. No, just the solid is fine. I don't need to see what you're doing. I don't need to see all that stuff going on in there. Nope, we're good. We're good. And she was laughing because she was like basically saying, I don't have one, but I could find one. Like I can get you one if that's what you want. And he was like, nope, I'm good. I'm good. And I looked at me and I was like, I can't see anything. When I'm going to be laying down, my belly's so big, I can't see. So I was like, it doesn't matter to me. Like they had like the moment where he came out and they like pulled the curtain so we could take pictures. And we have these, I'm not going to lie, they're amazing pictures of when they pull baby out. Like, it's beautiful. They're beautiful pictures. Even though you're like, oh, it's a C-section. No, it's beautiful. Him coming out, those first pictures, like, there's just something about those first pictures. But when he came out, they pulled the curtain. And I kind of was trying to look, but I'm like, I can't see anything. Like I'm big. There's all this stuff going on. I could kind of see, and there was pictures, and they were kind of holding him, like trying to do almost like a Lion King things. Cause I was like, I can't see, like you have to hold them up higher.
Yeah, they do hold them up nice and high. It's like up here because the person laying flat on their back can't see. But the one thing that cracked me up is my husband said is when they led him into the OR and they showed him the chair where he's going to sit beside my head. I'm like, oh, that's smart. Have the person most likely to faint sit down. He didn't, of course, but
I don't think Michael got a chair. I didn't think about that. I have to ask him. I think he was standing.
Okay.
Maybe they gave him a chair and I just was so busy.
Oh, you don't remember.
You know what? I don't think he did because I don't think he did because you know what? He was like, as soon as he came out, they went over to do their thing with the nurses and they're cleaning him off and doing all that. So he was right over with him and he like did the cord and did all that stuff. Like he was right there. The nurses were teaching him how to like change a diaper and put a diaper on in the room. Like, so I'm getting stuff done. And the nurses were over there like, yeah, like super excited. Like, here's your baby, and, like showing them all the stuff. I think even one nurse was like, look, 10 fingers, 10 toes, like it kind of like showing them off and all stuff, like as they were like doing their exam and doing all this. And it was like, they were just super like fun and super nice people. And he was over there. And so I was over and then, I just had a nurse going back and forth telling us, but I don't think they did give him a chair now that I think about it. I think maybe they offered him one and maybe he didn't, whatever, but he was like gone. As soon as baby was born, that's what his duty was. We made a deal like before. I was like, look, I'm getting a C-section. The deal is wherever the baby goes, you go. And that's what he did. Every time anything was going on, he just followed baby around as the chaperone pretty much of our baby. And that was his duty. And he did a great job. He was awesome. He also changed all the diapers, just in case all the diapers for weeks, by the way. I didn't do any of that. He did all of it. He did an amazing job. Like he was so on it. Like, oh, I got to change baby. Oh, he was so on it as like, he did a great job. Like it was pretty awesome.